Hello, hello, welcome. This is Here's to Your Good Health. My name is Linda Prezioso. I'm a nurse practitioner at Family Medical Center. This show is a community-sponsored program by WHIG-TV. This is for you, by you, and about you. So we talked last week about the consequences of diabetes and what can happen to your body if you're not, taking care of yourself and you're not taking care of your sugar and keeping it low if you are a diabetic. And so tonight we're going to talk about obesity. I kind of picked this topic tonight because I'm actually not working the rest of this week. I'm attending a obesity conference. It's virtual, so I'm at home on my computer listening, so it's kind of nice. I can sleep in a little bit and can run and get something done in the kitchen in between when we have our 15-minute breaks and things like that. So it's just a different change of pace for me. It's nice. I was out doing some gardening today. I got weeds. I got weeds. But an hour here and an hour there, and I'm going to get them done. So tonight we're going to talk about obesity, and it's common. We're all fat. I'm right here. It's very serious and it's very costly. So the prevalence of obesity in 2018 was 42.4% of the population of the United States is obese. That's half, y'all. And the prevalence from 2000 to 2018, so in 18 years, it went from 30% to 42%. So obesity-related conditions include heart disease, stroke, type 2 diabetes, certain types of cancer, and that are some of the leading causes of preventable premature death. The estimated medical cost of obesity in the United States was $147 billion with a B in 2008. The medical cost for people who have obesity was almost $1,500 more than their peer that did not have obesity. Obesity affects some groups more than others. Non-Hispanic Black adults are the number one for obesity. The prevalence of obesity is 40% amongst adults from 20 to 39 years, 44.8% ages 49 to 59, and 42% of ages 60 and older. I thought this was interesting. I don't know how to fix it, but it says the association between obesity and income or educational level is complex and differs by sex and race and ethnicity. But overall, men and women with college degrees had a lower obesity prevalence compared to those with less education. Now, why is that? I don't know. I don't think it's because they're smarter. That's not it. Because they make more money, probably. They have the opportunity to buy healthier foods. If you're in a low socioeconomic group, those dollar hamburgers goes a long way to feed your family. And sometimes you've got to make that choice, I think. So, there's a lot going on in this community. Richard Joyner has the, what is it called? The Kanita Phone? I'm not sure what it's called. But anyway, he's got a great project in Edgecombe County in Kanita that teaches kids hard work and teaches them how to eat. They grow their food, they sell the food, they have beehives and they sell honey. And when I worked with Richard in the hospital years ago, he told me, I'm assuming that this is all still the same. I don't know. I haven't talked to him recently. But he would, he would pay the kids that came and worked for him, and they had to work. I mean, hoeing weeds out of a garden is not fun, and picking, tomatoes off the vine isn't all that fun either. After one or two is great, but then you got to go for rows and rows and rows. And he would pay them, but he would keep a certain amount of the money, I don't know what the percentage was, and put that into an account, and that went towards their higher education. So, it taught kids hard work, it taught them to earn money, it taught them how to save money, it taught them the benefits of all these things, of getting a higher education. So, I mean, all in all, it was a win-win-win situation, I thought. And he was nominated several years ago. At one point, CNN had like Hometown Heroes, I think was the name of it. And he was one of the contestants. He was one of the finalists that would have won the Hometown Hero thing. So, that's a great claim to fame, I think. And that's happening right here. He's a pastor. He has a church in Canada. And he has recognized the fact that all those people are so poor and they don't know how to eat. They don't know what to do with fresh foods or fresh herbs. They haven't been taught that. And so it's really it's an opportunity for so many people in this area to give, to give into that program, and maybe start one around here in Nash County. I don't know, but it's just, I think it's pretty cool. So the obesity in education pattern was seen the same throughout all the ethnic groups. So it didn't matter if you were black, Hispanic, white. If you had a college education, you had a better, you had a lower weight. So I just thought that was kind of interesting. I wish I had the answers. I wish I knew how to take care of people that are obese. I can't tell you how many women, sometimes a man, but men don't come in as much as women do wanting to lose weight. And, everybody wants to take a pill and not be hungry and lose weight. And, that's okay for a jump start maybe, but if you don't learn how to eat right, and if you don't learn how to change your lifestyle, if you don't grab that peach instead of the potato chip, you're either going to gain it all back and then some. You've got to learn how to eat, and it takes time. And people don't want that. We live in an instant society. We got Polaroid pictures, and we've got, drive-through for food, and we've got microwaves that can heat up a cooked meal in 25 seconds or something. And so, our society, we're used to it all fast and quick. But, God made us to be slow cookers. And when you are changing habits and you are changing the way you might have eaten for 30 or 40 years, if you are changing how you cook to not the way your mama taught you, I mean, it's not easy. And there's a lot of other factors too. It's not just that, but we're going to talk about some of them as I go through this here. But it's very complex. That's one reason why I took this, signed up for this obesity conference, because it's very complex, and what works for me is not necessarily going to work for you. And so I wanted to learn. I wanted to figure out how I could help these folks as much as possible. It's not just a matter of taking in less than you put out. In other words, you take in fewer calories than you expend by exercise or however, working hard and climbing up and down stairs if you're, or climbing up and down ladders if that's what your job is. That's part of it, I think, but it's not the whole thing. And then there's genetic factors. There's some obesity runs in some families more than others. So, it's just, It's tough. It's tough, and I really want to learn and figure out how to help as many people as I can. I really think one of the keys is behavior modification, and that is like I just talked about, learning how to cook fresh, learning how to use herbs for flavor instead of salt, learning how to grab the peach instead of the potato chip. And that's going to take time. You know, I tell my patients, how do you eat an elephant? 1 bite at a time. How do you lose weight? 1 pound at a time. It's not, you didn't put it on overnight, and it's not going to go away overnight. It's going to take time. So we'll just go into some of this. All of this information is either from the CDC or from the National Institute of Health. That's where I've gotten this information tonight. So overweight and obesity is common and increasing in the United States. Obesity is caused by the increase in the size of the amount of fat cells in the body. So we have a certain amount of fat cells in our body. That's whether you're skinny or whether you're fat. When you're fat is because the fat cells increase in size. And you know, doctors measure the body mass index, the BMI, and that is one of the core measures of insurance now. They want to know what your BMI is. Some insurance companies want to know what your waist is, inches, because they determine that the thicker you are through the waist, the more fat you have around your internal organs, and that makes you more at risk for some things than people who are thinner. Now, but I want to say that you can be skinny as a rail and still not be healthy, because, you know, I mean, you've still got to eat right, you've still got to exercise, you've still got to put the junk food down, that kind of thing. So being fat doesn't necessarily equate to unhealthy. Being skinny doesn't necessarily equate to healthy. But we are screening, and now obesity is a medical diagnosis, just like diabetes or pneumonia or cystitis. And so, I think that the insurance companies and health people are learning how important it is to identify the obesity. They expect me as a provider to address that every time you come in, and I can honestly say I don't. I try at least once a year, like at their physicals, but you know, sometimes I only see people once a year, or sometimes they come in, if they come in for a sinus infection or a urinary tract infection, I am not going to address their weight. But I will now if they're diabetic or they're hypertensive or they're complaining to me about bone pain, you know, knee pain, back pain when they're 200 pounds and they should be 110, I'm going to address it then. But, you know, it depends upon what they come in for, whether I'm going to address it every time. And, you know, there's many problems with obesity. There's the metabolic syndrome, which is high blood pressure, diabetes, and hyperlipidemia, or increased cholesterol. And then there's also atherosclerosis. You know, that's when the plaque will build up in your arteries, and it can break off and go into your brain and give you a stroke, break off and go into your heart and give you a heart attack. And so we certainly don't want that, and that causes strokes and things like that. There's certain cancers that are caused by obesity, and there's certain sleep disorders that are caused by obesity. And then, of course, the treatment will depend upon the severity of your illness, and you know, your doctor is going to talk to you about lifestyle changes, heart healthy eating, increased physical activity. There are some approved weight loss medications. For some people, surgery is an option. I don't mind giving people weight loss medicine to help them jumpstart, but they've got to show me what they eat. I mean, if you eat, you know, you skip breakfast and you have a bag of chips and a Pepsi Cola for lunch, and for supper you might eat some spaghetti. That's not a good healthy diet, and I'm not going to give you pills to promote that kind of lifestyle. We've got to talk about what's healthy for you and what you need to fuel your body. I tell folks, you know, just like if you put bad gas in a car, it's going to sputter and putt-putt up the hill. But if you put good gas in it, your car's going to run smoothly and go. Well, it's the same with fueling your body. If you fuel your body with junk, you know, you eat Cheetos for breakfast and Pepsi Cola and Nabs for lunch and pizza for supper, you know, you're not giving your body good fuel, and so you're going to go putt, putt, putt up that hill. You're not going to be able to do as well as your counterpart that eats healthy. So we'll just kind of go into it here. So energy imbalances cause the body to store fat. Energy imbalance can cause overweight and obesity. And energy imbalance means that your energy in does not equal your energy out. The energy is measured in calories. Energy in is the amount of calories you get from food and drinks. And let me just stop here. Stop drinking sugared drinks. It's empty calories. Sure, I guess sweet tea tastes good. I don't know. I don't drink sweet tea. Wasn't raised on sweet tea. Don't get sweet tea. But, you know, water has got to be your primary drink. Now, is it okay to have a glass of sweet tea with maybe lunch? Yeah, but it's not okay to drink a gallon of it a day. And people do that. It's amazing to me. Or they'll drink 5 and 6 sodas a day and maybe 1 cup of water. You know, our body is 60% water, and we've got to keep that up. And it's just, I'm sorry, I go off on rabbit trails, and I've got my little areas that I like to get on my soapbox. So anyway, energy in is the amount of calories you get from food and drinks. Energy out is the amount of calories your body uses for things such as breathing, digesting, being physically active, and regulating body temperature. So believe it or not, you use calories by breathing in and out. You use calories when your body regulates its body temperature. You know, if you are outside and it's hot and sweaty, your body is trying to produce the sweat to make you cool off, and that is an energy producer. And then, of course, your body needs nutrients to make the energy, and those come in the form of carbohydrates, which are also sugars, proteins, and fats, and you get all that from the foods you eat. You know, if you buy all processed foods, anything in a box or cellophane wrapped container, it's full of sugar, salt, and fat. Well, what's the one food that you need for your body is fat. But if that's all you're eating, you're putting in too much fat, and you're putting in too much sugar, and you're putting in too much salt. So, you know, we've got to just think about what we're doing and do it right. So, carbohydrates, protein, and fats, they do make energy to help you get through your day and with all your bodily functions, and then they'll store energy for future use. Sugars are stored in the liver and muscles, and fat are stored in triglyceride in fat tissues. The amount of energy that your body gets from the food you eat depends on the type of food you eat, how the food is prepared, and how long it has been since you last ate. The body has 3 types of fat tissue. I did not know this. We have white fat, brown fat, and beige fat. I thought fat was yellow, so there you go. That shows you what I know. And the body uses all of those to fuel themselves. It regulates its temperature in response to cold and store energy in future use. So white fat is its tissue can be found around the kidneys, under the skin, in the buttocks, thighs, and abdomen. Some of us have a lot of white fat. This fat type stores energy, makes hormones that control the way the body regulates urges to eat or stop eating, and makes inflammatory substances that can lead to complications. And you know, if you've got arthritis or you've got something, you know, with an inflammatory process, you could have inflammation around your heart, you can have inflammation around your lungs, and all of that is damaging to your body and damaging to your health. Brown fat is located in the upper back of human infants. This fat releases stored energy as heat energy when a baby is cold. It also can make inflammatory substances. Brown fat can be seen in children and adults, but primarily in babies. Beige fat is seen in the neck, shoulders, back, chest, and abdomen of adults and resembles brown fat tissue. This fat type, which uses carbohydrates and fats to produce heat, increases when children and adults are exposed to cold. There are some genetic syndromes, and I chose not to go into these because genetics is very complicated to me. But there's the Prader-Willi syndrome, the Bardet-Biedl syndrome, the Alström syndrome, and the Cohen syndrome. Those are all genetic syndromes that are associated with obesity. And the studies of these are helping researchers to figure out, why does Linda get this and Judy doesn't? You know, because we're all different, we're all uniquely made, and sometimes it's your genetics, and they don't know why, so they're trying to figure all that out. And then endocrine disorders can affect your weight. The endocrine system produces hormones that maintain energy in the body, and you can get a tumor affecting the endocrine system, and that can cause overweight and obesity. Hypothyroidism is one of these. If you have low levels of thyroid hormones, then you have a decreased metabolism, and so weight gain is pretty easy under those circumstances. People with hypothyroidism produce less body heat, have a lower body temperature, do not efficiently use stored fat for energy. Then there's Cushing's syndrome, and you know, President John Kennedy had Cushing's syndrome. Of course, nobody talked about that in those days. You didn't talk about anything that was some kind of an imperfection in your body. You know, all of the TV stars, they never told you if they were gay or, you know, having an affair. They always, you know, showed them as these perfect little family folks, and it was all a lie. But anyway, Cushing's syndrome has high levels of glucocorticoids, and high cortisol makes the body feel it's under chronic stress. Excuse me. As a result, people with Cushing's have an increased appetite, and the body will store more fat. Then there's some tumors such as craniopharyngioma, I practiced that on the way here, that can cause severe obesity because tumors develop near parts of the brain that control the hunger. All right, it's time for our first break, and so we'll be back in just a few minutes with more of Here's to Your Good Health. Don't go away.
At Downey's Hearing Care Associates, we are dedicated to taking care of every client by providing personal, high-quality hearing care services. My staff and I know hearing loss affects each person and their loved ones differently, so we give you the time and the care you need to ensure the hearing technology chosen fits your lifestyle. At Downey's Hearing Care, we also make custom ear molds and specialize in emergency hearing aid repairs. Downey's Hearing Care Associates has 2 locations, one in Knightdale and one in Rocky Mount. We have hearing lives to save.
Hi, I'm Richard Koss, pharmacist and owner of Almonds Drug Store here in Rocky Mount. Here today with my wife and 2 daughters. For over 75 years, Almonds Drug Store has been the pharmacy of choice for residents of Edgecombe and Nash County. Our family is proud to call Rocky Mount home, and we are excited about the new services and products we are adding daily at both of our Almonds Drug Store's locations and also at our medical supply store.
Come in and see us at Almonds Medical Supply. We're an extension of Almonds Drug Stores, your local hometown pharmacy. We're here to service all your needs, from wheelchairs to walkers to orthopedic supports to compression hose to hard-to-find wound care supplies. And you'll always get that hometown customer service.
We want our patients to pay the best prices, get the best service available, and have a better pharmacy experience than they will get anywhere else. Our staff is committed to going above and beyond to meet our patients' needs. Whether it is working with your provider to get you the best medication at the best price, contacting your provider to get you refills or a prior authorization, or taking the time to review each of your medications with you personally, or perhaps even helping you find an old-time remedy or other hard-to-find items, your Almonds Drug Store staff will work hard to meet your pharmacy needs. At Almonds, we will deliver your prescriptions for free. Both of our stores have drive-through windows, we guarantee short wait times, and our pharmacists will come out to greet you personally and answer any questions you have. If you want to be met with a smiling face, or even want someone to greet you by name when you walk through the doors, we are the pharmacy for you.
Call Almonds Drugs today.
443-3138 or 446-0014.
Hey, I'm back. Welcome. Here's Sugared Health. We've been talking about obesity, and we're talking about some of the things that make us fat. Eating too much does, eating the wrong things does, not exercising does, eating sugared or drinking sugared drinks and just having empty calories is going to make us fat. And some medicines can make us fat as well. Antipsychotics, antidepressants, anti-epileptics, that's for epilepsy, and anti-hyperglycemics, that's to keep your sugar down. Some of them, can cause weight gain. So, you've got to talk to your doctor about if you want to come off of any of these medicines that you're on. Don't come off of them unless you talk to your doctor and have a plan on what you're going to do. Several parts of your body, your stomach, intestines, pancreas, and fat tissue, use hormones to control how your brain decides if you are hungry or full. Some of these hormones are insulin, leptin, glucagon, GLP-1s, peptide, and ghrelin. And a lot of those big names are in diabetic medicines. It's just that they're so expensive. So what are some of the risk factors for obesity and being overweight? Unhealthy lifestyle, environment, age, family history, genetics, race, ethnicity, sex. Some men are more prone to be thinner than women. They have a higher muscle mass. Healthy lifestyle changes can decrease your risk for developing being overweight, and being obese. So lack of physical activity is just terrible. They say now that the new smoking is the couch potato. Smoking has really gone down, and we've gotten a lot better about not smoking. Now we've got to be a lot better about getting up and move. And I'm here to tell you, and my husband will verify this, if I am, I've worked for 4 days, and maybe sometimes I have to go out at night. I always go out on Wednesday nights, of course, because I'm here. And so, sometimes I get home from work, especially on Thursdays, and I hit that chair and I don't get out of it. And I'm not proud to say that, but that's how tired we get. So I understand getting tired. I understand not wanting to do things. I get it. But what I have done to kind of overcompensate that is I've started getting up 15 minutes earlier than I did before. I still sit and read my Bible and do my devotions and drink me a cup of coffee. Then I go out on my porch and get on my elliptical and read my book. And then I get ready for work. So I've got to do it in the morning because that's when I have the most energy, and that's when I'm always home in the mornings. There's some nights, some weeks, I'm gone 3 nights out of the week, or 4 nights out of the week. So I have to do it then. That's what I have to do for me. So, you know, and then I found that for the most part I'm sleeping better because I'm moving more. But we have so much lack of activity because of TV, computer, video games, other screen usage. We sit down and play games on our phone, or, you know, do the Instagram thing or whatever. So, you know, we've got to change that. We've got to be physically active. We've got to reduce our screen time, and all that can help you aim for our healthy weight. And then, you know, we've already talked about eating poorly and too much saturated and trans fats. You're going to find all of that like in honey buns and ho-hos and all that stuff. That, I mean, it's good. I know. I like it too. But not only is it full of trans fats, but it's also, you know, the shelf life on some of that is 2 and 3 years. What is it doing inside of you if it can sit on a shelf for 3 years and not go bad? I just don't think it's good. And there's been a lot of studies of people with high BMIs, and sleep there's a relationship between sleep and how our bodies use our nutrients, and how lack of sleep can affect hormones that control hunger urges. So we've got to be able to sleep. And acute and chronic stress affects the brain and triggers the production of hormones such as cortisol that control our energy balances and hunger urges. And that stress can make you, acute stress is going to do one of 2 things. It's either going to make you eat everything under the sun, or you don't want to touch food at all. And that's just, we're all different like that. So, you know, I'm a stress eater. You might not be. One isn't better than the other. Well, maybe it's a little bit better. I don't know. But anyway. And then, of course, childhood obesity is a serious problem. You know, what's wrong with giving your kid an apple when he comes home from school instead of a bag of chips? I mean, you know, I'm proud to say my daughter-in-law does a great job of raising her kids, and they will grab an apple just as much as grab for the chips. Now, they eat the chips too, believe me, they do. But, you know, we've got to instill those good habits in them, you know, and they drink a lot of water. They'll have a soda every once in a while, but water is their drink of choice, or their mother's drink of choice for them, probably not their drink of choice. And if you are obese as a kid, then chances are you're going to be heavier as you become an adult. And then we've talked about the social factors, socioeconomic status, you know, and then we have this easy access to unhealthy fast food, and some people have limited access to recreational facilities or parks, and few, you know, some people don't live in a safe neighborhood where you can get out and walk. I live in a neighborhood where I could get out and walk. I don't much because, well, now I can. I didn't when it was dark, you know, because I'd come home from work and it would be dark. So I didn't then, but I'm starting to do that more now. And then, you know, there's exposures to chemicals, and, you know, I'm big about that too. But exposure to chemicals known as obesogens, and they can change our hormones and increase the fatty tissue in our bodies. So, and I think we've already talked about that. Overweight and obesity can run in families. Eating too much or too little during your pregnancy can change your baby's DNA. and can affect how your child stores and uses fat later in life. Also, studies have shown that obese fathers have DNA changes in their sperm that can be passed on to their children. Now, isn't that freaky? I mean, who knew all this stuff? And then, of course, it's, the rates of obesity in American adults are highest in blacks, followed by Hispanics, and then whites. And it's true for men and women. Asian men and women have lower BMIs, but they have higher amounts of unhealthy fat in their abdomen. So every ethnic group has something. So what should your BMI be? A healthy weight is, the BMI should be 18.5 to 24.9. I can't tell you how many BMIs I see that are 40 and 50. That's like 2 people, sometimes 3 people. Overweight is your BMI is 25 to 29. And if I have a patient with a BMI under 30, I'm happy. I think, that's great. And then obese is 30 or above, and morbidly obese is 40 to 50. And I'm telling you, I see people that are 400 pounds. So we use that BMI. And so, your doctor's going to tell you, or you can ask, at least in our office, if you get weight on the scale, we're going to have a BMI. We can't really calculate it accurately unless we have that weight, because it's based on weight. But that, like, and I said earlier, that's what the insurance company is looking at now, is BMIs. And I fill out plenty of forms from companies that their health insurance company that they've contracted to have health insurance for their employees. They're looking at that BMI, and they're looking at that waist circumference. So you've got to think about that too, because we can't get along too well in this world without insurance unless we eat healthy and keep our weight down. I mean, I've got 70-year-old people that have no health problems. They take vitamins. I've got a 98-year-old, and she takes a small amount of lisinopril for blood pressure. That's her only problem. So, we just have to be better in what we're doing. We just have to be. Let's see. And then, there's overweight and obesity can also have an unhealthy fat distribution. I tell everybody I'm like a baked potato with toothpicks for arms and legs. My arms aren't real big, my legs aren't real big. I got all my weight right here where we don't want it, where it's not supposed to be. Increased waist circumference suggests that you have increased amounts of fat in your abdomen. Well, that just makes sense, doesn't it? Increased weight circumference is a sign of obesity, and you are really at risk for complications. And type 2 diabetes is one of the big ones. And then visceral fat, that's the fatty tissue around your abdomen and organs. While we do not know what causes the body to create and store visceral fat, it is known that this type of fat interferes with the body's endocrine and immune systems and promotes chronic inflammation, and that all contributes to obesity-related complications. Type 2 diabetes, high blood pressure, high cholesterol, higher increased risk for stroke or heart attack. So I'm going to stop right here, and we'll talk about some of the complications from obesity, but it's time for our next break. So I'll be back in just a few minutes with more of Here's to Your Good Health. Don't go away. See you in a minute.
At Down East Hearing Care Associates, we are dedicated to taking care of every client by providing personal, high-quality hearing care services. My staff and I know hearing loss affects each person and their loved ones differently, so we give you the time and the care you need to ensure the hearing technology chosen fits your lifestyle. At Down East Hearing Care, we also make custom ear molds and specialize in emergency hearing aid repairs. Down East Hearing Care Associates has 2 locations, one in Knightdale and one in Rocky Mount. We have hearing lives to save.
When faced with special care needs for elderly or disabled loved ones, families want compassionate, comforting care. That's Tender Touch Home Care Services' goal, providing the level of care we would expect for our own. With over 10 years of home care excellence, Tender Touch provides an array of services that keeps your loved one at home. From personal care, light housekeeping, errands, and meal preparation, to our private duty care program, which combines all of our home care offerings in one package.
Tender Touch Home Care Services, where your needs are our concern.
Hi, I'm Richard Koss, pharmacist and owner of Almonds Drug Store here in Rocky Mount. Here today with my wife and 2 daughters. For over 75 years, Almonds Drug Store has been the pharmacy of choice for residents of Edgecombe and Nash County. Our family is proud to call Rocky Mount home, and we are excited about the new services and products we are adding daily at both of our Almonds Drug Store's locations and also at our medical supply store.
Come in and see us at Almonds Medical Supply. We're an extension of Almonds Drug Stores, your local hometown pharmacy. We're here to service all your needs, from wheelchairs to walkers to orthopedic supports, to compression hose, to hard-to-find wound care supplies. And you'll always get that hometown customer service.
We want our patients to pay the best prices, get the best service available, and have a better pharmacy experience than they will get anywhere else. Our staff is committed to going above and beyond to meet our patients' needs. Whether it is working with your provider to get you the best medication at the best price, contacting your provider to get you refills or a prior authorization, or taking the time to review each of your medications with you personally, or perhaps even helping you find an old-time remedy or other hard-to-find items, your Almonds Drug Store staff will work hard to meet your pharmacy needs. At Almonds, we will deliver your prescriptions for free. Both of our stores have drive-through windows, we guarantee short wait times, and our pharmacists will come out to greet you personally and answer any questions you have. If you want to be met with a smiling face, or even want someone to greet you by name when you walk through the doors, we are the pharmacy for you.
Call Almonds Drugs today.
443-3138 or 446-0014.
Hey, welcome back. This is Here's Your Good Health. I'm Linda Prezioso, a nurse practitioner at Family Medical Center, and we've been talking tonight about obesity. We're going to go into some of the complications, and I've already addressed them somewhat, but I just cannot impress upon you how important it is to lose weight as much as we can. And as I attend this obesity conference and learn more, I'll be bringing more information to you. But today was the first day, and it didn't start till 1, so I just had a couple sessions this afternoon. But I've got all day Thursday and all day Friday that I'll be listening to them and learning. So I'll bring some tips to you when I get them myself. All right, so these are some of the complications that you can get from being obese. And this is just being fat. It has nothing to do with anything else, just having too much body fat. Metabolic syndrome, type 2 diabetes, high blood cholesterol and high triglycerides, diseases in the heart and blood vessels, blood pressure, high blood pressure, atherosclerosis, heart attack, stroke, respiratory problems such as obstructive sleep apnea, asthma, and obesity hypoventilation syndrome, back pain. Back pain is the number 1 complaint in a doctor's office is back pain. We've all got back pain. Sometimes we get it from, overdoing, overstressing, helping somebody move and picked up boxes all day long, something like that. But a lot of times it's because of our weight. It can cause non-alcoholic fatty liver disease, and that can lead to cirrhosis. Every time we hear the word cirrhosis, we think it's from drinking, and that does cause cirrhosis, but you can have the non-alcoholic cirrhosis as well, and that is from fat. Osteoarthritis is a common chronic inflammation that damages the cartilage and bone in or around an affected joint. It can cause mild to severe pain and usually affects weight-bearing joints, hips, knees. Who doesn't know somebody that hasn't had one or both knees replaced and one or both hips replaced? It's the major cause of knee replacement surgery in patients who are obese. So what are we doing by being fat? We're just making the orthopedic surgeons rich. Urinary incontinence. You can have uncontrolled, unintentional leakage of urine. Chronic obesity can weaken the pelvic muscles, making it harder to maintain bladder control. While it can affect both sexes, it happens more with women. Gallbladder disease, emotional health issues such as low self-esteem, depression, and this occurs commonly in children. Cancers of the esophagus, pancreas, colon, rectum, kidney, endometrium, ovaries, gallbladder, breast, or liver are obesity can play a role in all of those cancers. Researchers now know that visceral fat, which is deep inside your abdomen, that releases factors that promote the inflammation. Chronic obesity related inflammation is thought to lead to insulin resistance, diabetes, changes in the liver, cancer. And so they're doing a lot more research on the visceral fat, the fat around your internal organs. So we're going to diagnose you as either a normal weight, and obese, or morbidly obese. And like I said, your insurance companies are taking a big look into that, and they are they're really dinging people who are overweight, just like some insurance, and you'll get better insurance rates if you're not a smoker. It's now they're getting on the obesity as well. So some of the blood tests that docs can do. Well, we do a physical exam, but all you gotta do is look and say, okay, she's overweight. Then you can look at her weight and say, okay, she's obese or morbidly obese. Some of the blood, you might be gaining weight and you can't figure out why. This does not really pertain to menopausal women so much. God has made us to gain 10 pounds when we become menopausal. I don't know why. I don't like it, but you're going to have to take that up with Him. He's the one who created you and designed you. I'm just sending over some information. But blood tests, you can have a thyroid because your thyroid can be overactive or inactive, and that can contribute to obesity. Primarily underactive thyroid. Cortisol and ACTH can rule out Cushing's syndrome. And then you can check testosterone and DHEA tests that can help rule out polycystic ovarian syndrome. You can have a pelvic ultrasound to see if you've got those cysts on your ovaries. So what are some of the treatments that we can do? Now we get down to the nitty-gritty. And of course, the first thing they say is healthy eating, change your lifestyles. But there's behavioral, increasing your weight, your physical activity. They have behavioral weight loss programs, and I tend to favor that the most because I think we need to have a change of the way we think. And we need to be able to say to myself, I was out last night, for instance, with my friend Jean White, who's been on this program with me. And we went to the Bin and Barrel, and a free glass of wine was offered. Well, I don't drink, so I didn't have any. Jean didn't have any because she said, I'm going to use my extra calories because we had finger foods, and they're always, they were hand prepared, but they're always probably a little bit more calorie laden. She said, I had to make a choice. I was either going to drink a glass of wine and have my calories that way, or I was going to eat this plate of food. That's the kind of behavior changes we have to make. And there are more and more behavior health behavior people that are let me start over. There are more and more people that are weight loss coaches and health coaches, and they will work with you on this behavior health, this behavior modification. And did you know that your brain's pleasure and reward centers can be stimulated by food and the act of eating? And that just makes it harder to lose weight. Researchers know that our brains can become patterned so that we feel pleasure or reward from eating. This can make us unconsciously crave food so our bodies feel that sense of pleasure. It can also make it hard to change our eating habits, eating patterns. It's more hard to lose weight, and it's harder to maintain a healthy weight. And so there's a lot of cognitive behavioral therapies that they're studying and using now to help retrain the brain not to associate pleasure with food and the act of eating. And let me just throw this in there, that sugar is so highly addictive that there was a study where there was an experiment, and they had rats in a cage, and one water jug had cocaine in it and one water jug had sugar in it. The sugar won over the cocaine every time. It's that addictive. So you might not be a drug addict of an illicit drug, but you're a drug addict of sugar, and I am, I can tell you that. So there are some medicines that we can use to, there's things that can change our way of thinking. There are some medicines we can take that we just feel full. It increases our satiety, so we don't eat as much. We feel full after less food. And then there's the surgical procedure, and for some people that's what it has to be. There's gastric bypass surgery, and that's a small part of your stomach is connected to the middle part of the intestine, bypassing the first part of the intestine. This decreases the amount of food that you can eat and the amount of fat your body can take in and store. a gastrectomy, and I've never heard of that for weight loss. I've heard of it if you've had to have part of your stomach removed for a medical problem, but you can remove a big portion of your stomach, and that will decrease the amount of food you can take in. And then there's gastric banding, and that's a hollow band that's put around your stomach, and it's tightened intermittently, and then that shrinks the stomach and you can't put as much in. So, you know, we have a great gastric bypass center here at UNC Nash. It has been a center of excellence in that program for many, many years, at least 12 or 15 years. And they do a great, you know, they have a big procedure of what you do. And it takes about 6 to 9 months to go through the program. And that's any program, it's not just Nash's. You know, because you've got to go through certain health things. You've got to have a cardiac visit and an EKG. You've got to have a endoscopy. They got to look down and look and make sure your innards can be fixed the way they want them to surgically. You have to see a nutritionist. You have to see a behavior health cognitive therapy person, and all that's got to be done prior to you having the surgery. So, you know, you just need to set some easy goals. Don't say, I'm going to lose 50 pounds. How about say, I'm going to lose 5 pounds in a month? And then if you exceed it, you feel great about yourself. And if you hit it, you feel great about yourself. But if you say, I'm going to lose 50 pounds, and then you know, you don't even lose 5 in a month, then you just say, oh, it's not worth it, forget it. So anyway, it's time for me to say goodnight. Thanks so much for watching, and I will see you next week, excuse me, with more of Here's to Your Good Health. Good night.
Safe and secure. These two words are simple yet powerful. In order to feel this way, you should know that you have the tools necessary to provide safety and security for yourself and your loved ones. As with any tools, learning how to properly use them is best learned from experts who we know we can trust. Experts who have a proven track record and a commitment to serve and protect. Enroll now in Sheriff Keystone's North Carolina Concealed Handgun Carry class, taught at the CPF Training Center in Rocky Mount. Sheriff Stone utilizes a first-in-class classroom environment and indoor firing range. This ensures a training experience that is welcoming to both first-time firearm students and those with more experience. An attentive staff that takes time to teach students the legal requirements of becoming a permitted concealed carry citizen. In addition, Sheriff Clee Atkinson teaches students situational awareness, self-defense, and skills needed to avoid becoming a victim. As you know, Sheriff Stone and Sheriff Atkinson have committed their lives to serving and protecting. There is a reason Sheriff Stone and Sheriff Atkinson's class book in advance. Come learn from two of the region's most seasoned and professional public servants. Safety and security, two simple but powerful words that can be a part of who you and your family are. Call 252-813-8898. Register today.